Dr. Rogers, paging. Good afternoon, Dr. Rogers from Cleveland Clinic Union Hospital in Dover, Ohio. How are you, sir?
Hello, Kelly. Good morning, or afternoon, I'd say.
Yes.
It feels like morning. It's been a fast day.
It's been a dreary day and a good day to talk about stroke with our guest today, Dr. Rogers, a very important topic. I'll let you do the introduction.
Yes, thanks, Kelly. So, Terry Manning is here today. She is our stroke program manager, and this month in May is Stroke Awareness Month, and it is such an important topic for us to be able to make sure that, because it's so time dependent, we really want our patients to understand everything about stroke as soon as they can, so that they can make quick decisions and get to the care that they need. And that's what Tara's going to talk about today with our great program that we have here, right here in Tuscarawas County.
Okay, and Tara, welcome. First time, I believe, on WJER.
Yes, yep.
So great to have you on Medical Minutes. By the way, to your entire staff of nurses, happy National Nurses Week. It's a team effort, right,
Yes.
Tara?
Yes.
And, I'm really sorry to be totally sobered by stroke being the second leading cause of death worldwide and the fifth most common cause of death in the United States. So this is why we really have to address it as a medical emergency. Tara, let's talk about the signs, the symptoms. It's kind of a new acronym you're throwing out there for us as well.
Yes. So the acronym is B FAST. B for balance, E for eyes, F for face, A for arms, S for speech, and T for time. So balance, any balance issues, loss of balance, stumbling, walking around, they look like they're drunk, but they're not. E for eyes, so double vision, blurry vision, loss of vision on one or both eyes. And then fast is what everybody is used to. F for face, so facial asymmetry or drooping. Arms, weakness or numbness in one or both arms. And speech, S is speech, so slurred speech, you're not really able to get your words out, things you're saying don't make sense. And then T is time. We really want to stress the importance of time. We want you to call 911 rather than waiting, thinking that symptoms will go away, take a nap. We want you to really come in, be seen. If you live out far from a hospital, please call 911. They can get you here a little faster than your family member might be, and you might not sit in the waiting room for a long time.
Right. And Tara, many of us have stories of family members, friends who have suffered a stroke on the range from a mild stroke to they passed away a day later because they weren't checked on. They had been down in their own home, and a day later, that, as you said, it could be too late. And then the slurred speech, of course, I'm very interested in. Had a family member, active grandpa, picking up grandchildren, out and about, life is good. His wife calls and he was not making sense, didn't pick up the children all of a sudden, out of the norm totally. His speech when she called was way off. Oh, he was speaking, but it made no sense at all. So she knew right away something was wrong.
Yeah.
And back to the time being the focus. Let's talk about how crucial time is when someone else is showing signs of a possible stroke.
Yeah, so time, especially in this area, is pretty crucial. It actually guides some of our treatment plans. Based on that time, we calling 911, they can alert the hospital as to a potential stroke victim. And then we actually get ready for that arrival of that patient. But time is pretty crucial. It may save brain cells, and that's what we're trying to do, because time is brain.
I love that phrase, time is brain. I've been studying that one. That's a new one.
That is a new one, yeah.
Time is brain. If there's one thing you walk away with from today's conversation with Dr. Rogers and Tara Manning, again, time is brain. And again, the treatment options, let's say once the patient arrives at the emergency department, what are our choices then for the options?
So there's really three main different options. The first option is the most sought after, and that's where we give you drug to help reverse the clot, try to dissolve the clot. But that one is really based off of your last known normal or symptom onset. So we can give it up from 0 minutes up to about 4.5 hours. And that's pretty big. The drug we give is called tenecteplase. It's a newer drug on the market, but it works really, really well. but you have to be within that window, and there's certain criteria you have to meet in order to get this drug.
Okay, and again, there are some risks, like with most other drugs. What could those risks involve?
So one of the main risks is bleeding. So if you're on Eliquis or Xarelto or Coumadin, we probably won't give that drug to you because of the risk of bleeding increases. Some of the other risks are we give you the drug and then for some reason you get a brain bleed. It's just spontaneous. Sometimes it happens. We did everything right. It just happens.
Okay, and then again, another choice, it is actual thrombectomy, did I say that
Yes,
correctly? Or
yeah.
clot removal,
Yes.
and a possible stent
Yep.
placement?
Yeah.
What would that involve?
So that's up to about the 24-hour window since your symptoms onset. If you're in that 4.5-hour window, you'll probably get the two options together. They want to try to break up that clot before they go to remove it. But yeah, that 24-hour window is pretty crucial as well. We want to, if there's a clot and we can see it and it's large enough, they'll go in, take that clot out, and you may get stents based off other factors.
Okay, now that is major surgery. Is that done at Cleveland Clinic Union Hospital in Dover?
No, we aren't. We're smaller than some of the other hospitals within our health system, but usually it's done at Akron or main campus.
Okay.
So those are the two hospitals we probably will send you to.
So our listeners, we all have to be aware there may be more time involved as we're thinking about time is brain and the travel involved as well. So good to know. That's as of right now, Dr. Rogers, right? That may change in the future. Tara and Dr. Rogers, neurosurgeons, have the ability to use a CT or a scan of the head and neck. If they are looking at something they don't like to see, now, first of all, can they see that here in Dover?
Yes, yeah. Dover's pretty capable. We're a primary stroke center, so what that means is we can treat, we can assess, we can diagnose stroke, but when it comes to thrombectomy, we can't do that. We can stabilize a head bleed, but usually those will send off to a bigger hospital. We just don't have the staff or the capabilities to, if they need immediate intervention, we don't have those available quick.
Tara Manny, RN, and Dr. Thomas Rogers from the Cleveland Clinic Union Hospital. Today our topic on Medical Minutes Stroke. And Tara, let's move on to, there is possibly a time when there is no intervention possible. Then what?
So then that's usually after that 24-hour window. Then we'll probably start you on aspirin, Plavix. We may or may not start you on Eliquis or Xarelto. That depends on if we find that you have atrial fibrillation, and then supportive care, so therapies, those things.
Okay, and as we move on to patient follow-up, so important to use your primary care, your neurologist, any kind of care after discharge. Let's talk about discharge. Maybe Dr. Rogers, you want to address that?
Sure. But one thing, actually, just want to talk a little bit about Tara as well, and have her talk a little bit about our stroke center. She alluded to it a little bit, but it's Nurses Week, so we love our nurses and they do an incredible job.
Amen.
But Tara, in her job here for the last year or so, she's been as our coordinator, really has shown all the capabilities we have here at Union. Even though we're small, we can, part of that Cleveland Clinic and part of that relationship is we can get patients up north to get that care. But tell a little bit about what we do in our stroke center and what things we've earned and what things we've done.
All right, so we'll start with the awards we earned. Those are easiest to talk about. So with the American Heart Association, they have a thing called Get With The Guidelines, and it's for a variety of different diseases, but for stroke it's pretty important. When I first took over the program, we were at a bronze level of award. Last year we won silver. This year we're actually slated to win gold for these.
That is fantastic. Congratulations to all the hard work and people behind making that happen. Tara, that is wonderful. Oh, congratulations.
Thanks.
And again, I'm sure you don't want to stop now. When you've had that kind of accomplishment, you want to keep it going.
Yeah.
So as we were talking about, intervention may not be possible exactly the way you wanted it to be, but when our patients are discharged, then you say about 1 to 2 days is a usual time frame?
Usually, it depends on testing. If they find anything extra or something out of the ordinary, they'll address that before we discharge you. It's the safest plan, is to address these issues before we discharge you, so we know what you might expect after discharge.
Okay, and Tara Manny, brand new to many families out there, so it's great to know you have a solid plan in store for us should we run into stroke, which is our topic today on Medical Minutes. Dr. Rogers, as we finish up here today, with the hospital's flow of patients, they need beds. You need to make that discharge happen.
Right.
Unfortunately, sometimes before we would like that reality to set in, but what happens in that situation?
It is, and it really is just more of a request to our patients and their families. Because we're smaller, we do rely on that flow of patients, and we know transportation is very difficult here locally to be able to arrange for somebody to get picked up, but we try to anticipate when someone's going to go home the next day. What we'd like to know is our families would know, hey, we're probably going to go home tomorrow, and if they could be prepared to try and get our patients home earlier in the afternoon, because typically we admit a lot of patients later in the afternoon. That helps our ED flow and everything. So a lot of people want to stay later, or their families can't come in until after work. So we're just trying to see if we can anticipate the day before. That'll help our families to know they're going to go home maybe earlier in the afternoon. And it's really just a request, but we know it's hard on families to be able to get off work or to have that transportation. But it's just something to help our flow, and we just wanted to bring that up and we thought this was a good month to bring it up. So
Absolutely. Again, stroke awareness, and it all comes full circle. Tara and Dr. Rogers, can you drive home a point for all of us? Again, the mantra, the 3 words, time is brain, but help me with the power of prevention. I mean, obviously, we should not smoke. Any other things that we actually may be in control of to help prevent stroke?
yeah, I mean, I think this is something we talked about last week with Carrie, or last month with Carrie. It's just the wellness piece, controlling what you eat, your weight, controlling your cholesterol if you can, prevent diabetes, all those things we can do. Exercise is so important. And if you can do that to control those and make yourself as healthy as possible, that decreases your risk for stroke and heart attacks and things such as that. So it's so very important to be able to do that prevention.
Fantastic. And know your friends, know your coworkers, know your family. If something seems off, it's the time to really pay attention. And Tara Manny, congratulations on all of your accomplishments so far. Can't wait to see what's in your future.
Thanks.
Dr. Rogers, thank you again for being a part of our Medical Minutes, our topic today, stroke. If our listeners have any other questions, how do we reach you?
The best way is through your PCM, through your primary care manager, but also through unionhospital.org, and be able to provide questions. But your primary care provider is the best person to be able to answer all of your questions and to get you on the right step towards wellness.
Fantastic program. Tara, Dr. Rogers, I have to work this in before we go. There's some aroma. We are neighbors here, WJER across from Cleveland Clinic Union Hospital. What is that wonderful aroma I'm sensing?
Well, for Celebrating Nurses Week, we do have food trucks that are out in front of the hospital this week, and it gives an opportunity for our caregivers to have a little difference in maybe some of their things that they're eating on a regular basis. So just ways to celebrate the nurses, doing some great stuff at the hospital. But they are the heart of our hospital, and we really need them for everything we do. And we just, we're just so excited they're here on a daily basis, providing the care to our patients.
Fantastic. Tara Manny, RN, Dr. Rogers from the Cleveland Clinic Union Hospital, Dover, Ohio. Thank you so much for another great edition of Medical Minutes here on WJER.